Department has confirmed that the national death toll from the cholera outbreak has now reached 43. The country has around 800 suspected cases with 197 lab-confirmed infections. Gauteng accounts for the bulk of these infections, with the Free State, the Northwest, Mpumalanga and Limpopo also affected. People are being urged to maintain strict personal hygiene, especially during food preparation and at social gatherings, including funerals. Let's get you the latest on the story. Deputy Health Minister Dr. Sibongiseni Dhlomo joins us via our video link this morning. Deputy Minister, thanks very much for coming on. It's great to see you. 43 now confirmed deaths from cholera. It's very worrying indeed, especially because it does appear that there have been, in the last updates on this number, quite big jumps in the number of deaths we're seeing.
Good morning, Michelle, and good morning to the Newzroom TV viewers. Yes, it is actually, Michelle, 100% loss for that family and that family when the member of the family has died. When we give the global statistics, we are releasing this update, and we are hopeful, and we wish that this becomes our last update on the cholera outbreak in our country in the past months. It was over the past few weeks, Michelle, the numbers of admissions and suspected cholera cases have significantly reduced. We have even closed that failed hospital that we had established in an area called Kanana in Hammanskraal. Yes, the figures that we are quoting are correct, but we still maintain that it's mainly two provinces that were heavily affected. It's Gauteng heavily and Free State, because the cases that we are mentioning in Mpumalanga, Limpopo and Northwest were some of the clients or citizens who traveled to those provinces coming in from in and around Hammanskraal. The breakdown, yes, it is 43 of the deaths, 35 of those in Gauteng. But we urge all our South Africans to really maintain a high standard of personal hygiene, because, Michelle, I could still be in the same environment with you with cholera, but if we practice personal hygiene, when we are coming in from the bathroom, you wash hands. Before you handle food, you wash hands, because the source of this cholera is a contamination of water and or food. So we are actually picking up again around Hammanskraal that some social gatherings like funerals, that's where some of the contacts were picked up from. So again, if I could have been a service provider there, or I was actually asked to provide food, probably a material for cholera, I didn't wash my hands, and I can really infect quite a significant number of people there. So personal hygiene will still assist us greatly in this regard, Michelle.
I want to get to the issue of personal hygiene and the availability of clean water in areas like Hammanskraal in a moment, Deputy Minister. But I first want to talk to you about this death toll that we are logging. The official death toll, as we've been discussing this morning, now reaching 43. The worry is that activists in areas like Hammanskraal say that the real number may actually be much, much higher, even double the official number coming from government. What's your response to that?
I may not confirm or dispute that, Michelle, because what we have is actually the cases that have reached our health facilities. We do not have data of some of the people who probably might have passed on in some areas and probably were transported to the funeral parlors without us counting those. But also those figures could then count in and come in as Home Affairs records when we really bring that to us. But we pick up from the figures of our field hospital that we established and also our health facilities that we have. But we are working with the councillors, and we have worked with the councillors, particularly around Hammanskraal. I would not be able to confirm strongly that there are certain cases that we have missed, but maybe councillors can, because we work with them. They have been the ones who even were taking us around to the areas that are heavily affected, being Kanana. That's where we really concentrated largely.
Yeah. So let's discuss the issues around personal hygiene, Deputy Minister. You've stressed the importance of, food preparation, personal hygiene insofar as washing your hands. The advice is very similar to the advice we received under COVID-19. And we now know that Hammanskraal in particular is an area that's struggled with clean water resources, or lack thereof, for many, many years now. How far are we in ensuring that that community is able to implement the advice from government insofar as personal hygiene is concerned?
Michelle, we were surprised when we were in that space to learn that there's piped water in that area. But the mayor and the city of Tshwane were actually saying to the citizens, please do not use the water from our pipes for human consumption. They themselves were actually indicating that their water is not safe for human use. Now, we are glad, therefore, that that city of Tshwane municipality has now since been supported by the Water and Sanitation Department nationally, where they are really looking around and actually finding the source of this contaminated water. But meanwhile, they have been providing citizens with water tankers to really make sure that they source clean and safe water from some areas and therefore bring it to the community. As you are correct, we are also on the receiving end, Michelle, looking after those citizens who are already infected and affected. We depend on the sister department largely, and it is probably a wake-up call to all municipalities into the country that they do have a legislative responsibility to provide citizens with safe and clean water. But Water and Sanitation Department comes in to assist and make sure, because we too can do so much in looking after those who are infected and affected. We would still depend on the water source being actually looked into and be treated properly so that we do not have infected water or food into the citizens of our country.
So Deputy Minister, you know, it's not the first time we've had a cholera outbreak in our country. With this latest outbreak, what do you reckon we've done better this time around, and what lessons have we learned?
When I was still training as a student long time ago, that's when we had endemic cholera in our country, Michelle. By the government providing clean water here and there all over the country, that has been the biggest ever achievement to have. Was that I can tell you, every what we call waterborne disease is significantly reduced or eliminated by providing clean water and safe water for use, except for this very unfortunate situation of Hammanskraal, where they have water from the taps but still unclean. Number two, where we then want to continue with the process, we want to say to our citizens, where you are suspicious or you are not yet receiving clean and safe water, please can we err on the side of using jig, household bleach into our water. Just a spoon or two into a 20-liter container is good enough to really, and let the water stand for about 2 hours or 3. It is enough to really kill the bacteria in there. And again, our citizens have been saying we don't have enough electricity or water or firewood to cook and boil water. Yes, then we also, but if you could, boil the water, let it stand again and use it for all those areas where they are still suspicious of water being unclean. Cholera is now endemic in and around South Africa, in the countries around us, and that is why early in February it was picked up by citizens who traveled back from their homes in Malawi, but otherwise we had not had cholera for decades in our country since water installation were put in place.
Yeah, I'm sure you'll agree, Deputy Minister, that it's just not feasible that can be the advice from government in the long term, that we add jig to water and let it stand for a couple of hours. I can't imagine a situation where I'd like to have a glass of water to drink, but I first need to find a way to boil it, add some jig to it, and then let it stand for a couple of hours before I can drink jig with a teaspoon of water with a teaspoon of jig in it.
But Michelle, that's not for the 95% of our population, because I would not be able to have a good record, but more than 80% of our citizens in our country are receiving piped water now. Whether it's not in your household, it could be a standpipe in the village, and that water is relatively safe. Almost 80% of our citizens. I'm talking about the remaining 10 to 15% of our citizens, where there is some suspicion that the water that you are getting from the river is not safe. I'm talking about that population. But the rest of the population in the country, the improvement in terms of water reticulation in the country, has actually reduced significantly these waterborne diseases of typhoid, cholera, and all those illnesses.
Cold comfort for the people in Hammanskraal who continue to be part of those 15%. Deputy Minister, let me thank you for your time this morning. Dr. Sibongiseni Dhlomo giving us an update there on the latest cholera fatalities.